Hello and welcome. Today I am joined by Dr. Marlin McKay. Dr. McKay, what tools or tips would you give parents or caregivers who suspect that their loved ones may have meningococcal meningitis?
Yeah, I think it's very, very important because parents and caregivers are the first point of call before they bring them to us. So if they can be aware of what this particular symptoms are, timing is essential. Again, this word timing. So meningitis per se, and usually there may be an epidemic going around, so there may be a heightened awareness, or maybe there's been some sort of exposure. You may get a note from the school. So it's against that background, but it can occur anytime. I think it's very important just to highlight, there's usually the classic 4 symptoms, all right? We also say diseases don't read textbooks, so it may be, but these generally, fever, high temperature, severe headache, neck stiffness, and vomiting. Now, it's important to relay the message that they generally must occur together. So if it's just vomiting, it's probably not meningitis. So it's just one. Usually there's at least 3 of the symptoms. Now, neck stiffness is important. It's not neck pain. Now, neck stiffness, I always tell, just check your child. Can you look up? Can you look down? Now, some with neck stiffness will do this and then won't be able to touch their chin onto their chest. That is stiffness. Pain is any movement is sore. That's generally not meningitis. The problem comes in with babies. It's much more difficult to make the diagnosis, but any baby who is sort of drowsy, high-pitched cry is very important. And there are certain signs that doctors are trained to look at. Dehydrated, loss of appetite, almost seems not aware of one's surroundings. So any level of suspicion with a baby. And the classic thing to look for is spots, especially spots on the back, these purple purpuric spots that may indicate a severe form of meningitis. Very, very critical. But generally, the good news is that parents and caregivers react timeously and they get scared. Something's going on. It doesn't just look like flu or something like that. Let's get our baby to the doctor. And that sense of timing is very critical in getting the proper treatment in time.
And what would you say to people who choose not to vaccinate their children?
Yeah, so this is something that I speak out strongly against, and I think it's very important that we relay the right message. Number one, you are putting your child at risk of illnesses that we just talked about, and serious illnesses like meningococcal meningitis. Number two, so the first part is that you're putting your child at risk. Number two, it's affecting the community. So when we have these mass immunization campaign, we aim to get a critical proportion of the population vaccinated in order to confer what we call herd immunity or community immunity. What that means is when you have reached that critical proportion, then the community is relatively safe. But when more and more parents and caregivers are opting not to vaccinate their children, that critical proportion starts to drop. And so the amount of kids who are unvaccinated rises, and then you run the risk of these illnesses and conditions coming back. And so we're actually starting to see a resurgence of conditions and infectious illnesses that were put to bed long ago. And this is what we're seeing in the States and other countries. And may never come to South Africa, where things like smallpox can suddenly come back because we are not vaccinated, and polio and diseases like this. So it's very important on a personal level, make sure that your child is protected. But on a community level, I mean, I would not like my son to be in a class with other kids who are not vaccinated because their parents have issues with that, because now they are impacting my child and his risk of now getting something like meningococcal meningitis. So it's important on every level that we make sure that that herd immunity stays in place so that these diseases don't come back and that our kids don't be put at risk of serious illnesses.
All right. And what would you say to parents who prefer not to vaccinate their children, or parents who opt to vaccinate their children after the age of 2 due to cost consideration?
You know, the issue of cost always comes up in anything that we're discussing, and it's a very important consideration. However, we have to factor in the cost of not giving the vaccine timeously and the sequelae of that. We have to make the point that this vaccine, for it to work, must be given from the age of 9 months up to 23 months. And the schedule must be given at least 3 months apart. If there's any delay in that, the vaccine will not be as effective as it should be. Now you factor in the cost. If that is not done, You have the cost of our babies getting sick. We have the cost of them being hospitalized. We have the cost of the complications if the treatment is not administered timeously enough. The cost of losing a limb, the cost of blindness, the cost of deafness, the cost of epilepsy. And how do I even put a price on the cost of losing a loved one because that vaccine was not given timeously? So I think when you weigh up the benefit and the risk and the expense related to that, it's really a no-brainer. And the message is, make the sacrifice and let's get our kids vaccinated according to the right schedules.
Dr. Meningococcal disease incidents are supposedly very low in South Africa. What would you say to that from a HCP perspective?
I think it's very important to emphasize that even though the numbers or the incidence may be low, that's the number of new infections annually may be low, doesn't make the disease or the illness any less serious. One of the issues could be, underreporting. Just remember that sometimes patients come in very sick and the healthcare practitioner may initiate treatment before the lab results are actually available. Sometimes patients may die even before they get to the hospital. And sometimes they may be in an institution where they are treated that the results are not forwarded or the disease is not notified. So in my view, I think there may well be even more cases than we actually know about, which means that we need to take it more seriously. And never underestimate that just because something has a low incidence, it is not as serious as more common illnesses. So if you take that whole thing together, the basic message for us as healthcare practitioners is we must take it seriously and we must look for it and we must educate and inform our patients or our families of the importance of being vaccinated against it.
And on that note, what would you say to parents who are consuming this information and drawing conclusions about the status of this disease in the country?
My main message to them is, again, be informed. Read up and know everything you need to know about meningitis, especially in the younger age groups. Be informed about the importance of the vaccine that is available. Be informed about the dosing schedule. The importance of the timing of the two vaccines is from the age of 9 months to 23 months, and the importance of coming back. Be informed about the symptoms, and the symptoms can beat even some of the best doctors. The symptoms can be non-specific, and so be aware. And the main message is, if you don't know what's going on and concerned, get help and get to your nearest healthcare facility so that the diagnosis can be made timeously and treatment can be started.
Thank you so much for joining us today, Dr. McKay. And remember, protect yourself and protect your community. If you suspect you or any of your loved ones have been infected by meningococcal meningitis, contact your nearest healthcare practitioner. Prevention is better than cure. Thank you and goodbye.